There we go.
Hello, I'm Nancy West. I'm the executive editor of InDepthNH.org. We publish every day online from the New Hampshire Center for Public Interest Journalism. And I'm here today with Beverly Stoddart. She's a writer and a speaker. She also writes a column for InDepthNH.org called A New Hampshire Life, which focuses a lot also on New Hampshire authors. And we have a special guest today to talk about vaccines for children now that the 5 to 11-year-old vaccine has been approved. Dr. Christine Arsnow. Dr. Arsnow practices at Concord Pediatrics, and she's also the vice president of the New Hampshire Chapter of the American Academy of Pediatricians. Welcome, Dr. Arsnow.
Thank you, Beverly.
I'd like to ask you, we're going to ask you some questions, but we're really interested in what you're seeing on the ground. And even before I start, I want to say thank you for your service. This pandemic has been so rough on the medical industry, on medical personnel, and we really appreciate the work you're doing. And I'd like to start by asking you, why should parents have their 5 to 11-year-olds vaccinated against COVID-19?
So sorry, Nancy, I called you Beverly for a second there, but one of the things I like most about being a pediatrician is that parents and I both have the same goal in mind, which is their child's best interest. You know, when I was in medical school, if you're a doctor of adults, sometimes you find yourself butting heads with your patient. But I love the fact that when I walk into the office, even if the parent and I might have a slightly different idea about what to do, our goal is the same, and that is the best outcome and the best interest of that child. So I really encourage parents, if they have any questions or concerns, to talk to their pediatrician about getting the COVID vaccine. We love talking about vaccination. We love talking about ways to keep your kids healthy. And I completely understand there's so much information out there and it's confusing. And so I would recommend, that parents, if they do have questions, call your pediatrician, make an appointment, bring it up at your child's well check. So with that having been said, I recommend that my patients ages 5 and up receive the COVID vaccine, primarily because I really believe in the safety of the vaccine. At this point, it is extremely well studied. We've reached the 1 million mark of 1 million children ages 5 to 11 have received their first dose. Over 7 million children ages 12 and up, 12 to 17, have received a dose of the vaccine. And that number is like a month old. So it's probably far more than that now. And the complications of COVID in younger people are more rare than we see with adults, but they do exist. Unfortunately, I'm sure you've heard of multi-system inflammatory syndrome, which is a vascular disorder that can result following COVID. We do see, for example, myocarditis following COVID. I know we're going to talk about that related to the vaccine later, but the disease COVID itself causes myocarditis. Long COVID, which can be really debilitating, especially for these adolescents and teens. And at this point, we have a safe way to prevent those outcomes. And that's why I recommend it for my patients.
Well, and then so based on that, doctor, and thank you again for joining us. So should children who have had COVID-19 get the vaccine? Does it make a difference in their lives and their little bodies?
Yeah, I've gotten this exact question. So you're right that having the disease itself creates some natural immunity. So patients who have had COVID are slightly protected. However, there is data that shows that getting the vaccine substantially increases that protection. So patients who have had COVID and are vaccinated are less likely to get COVID again than patients who have had COVID and are unvaccinated. So I do recommend it for those patients after the symptoms of COVID have resolved.
What are some of the other questions that parents are asking you?
I think we received many questions. A lot of people are unfamiliar with the process of an emergency use authorization, the way that this vaccine was sort of introduced to us rather than the FDA, the traditional FDA approval process. And what I've learned, myself from researching this and reading the, I think it's always best to go to the source, like the CDC, the FDA websites, rather than perhaps some person's speculation about them. The process of an emergency use authorization is implemented when the government recognizes that there is an immediate need for some sort of medical intervention, in this case for a vaccine. And the government essentially cuts out the red tape, so ensures the rigor of the process. There's still extensive testing, there's still extensive monitoring, but things like production and shipping and supplies, the government steps in and is like, we will give you all the money you need to get these things. We'll, hire people to work in the factories, as opposed to with a traditional vaccine approval process, that was a lot slower. And so the whole process gets slowed down. With the emergency use authorization, the science is still very stringent and very strict and very cautious, but the processes are just moved along more quickly. So that's a big question again. Yeah.
You mentioned myocarditis earlier in our little conversation in regards to one of what's happening in the children. The European Union has chosen to elect a one-dose strategy. What's your feelings on 1 dose or 2 doses for our children?
Yeah, so myocarditis definitely made the news. And I understand, I'm a parent as well. Anything that, when you hear about something that might affect your child's health, we all just get so cautious, and everyone's anxiety is so high right now to begin with, So the way that I think of the myocarditis side effect, before I address the European, that question, but in general, so it is more likely to get myocarditis from COVID than you are from the vaccine. So the Children's Hospital of Philadelphia has a really nice vaccine education page that I'll give you the link for, or give you the address. But they had a great example. If you took a fictional community of 100,000 people in that highest risk for myocarditis, males ages 12 to 29. So this is the very highest risk. If they were vaccinated, about 5 might develop myocarditis. If
in total,
they are
5 in total.
In total, 5 out of the 100,000 in this very high risk group. If they're unvaccinated, you would most likely see 49, based on statistics, 49 cases of myocarditis resulting from COVID. So the number that they estimated was about 960 if they were unvaccinated of those males would get COVID, and then 49 of them would go on to get myocarditis. So it's that example to me made it very clear that the vaccine is still protective against myocarditis when compared to just being around in the community unvaccinated. Right. In terms of having a 1-dose series, one thing to note is that the dose regimen for the 5 to 11-year-olds is a smaller amount. It's the same active ingredient that we're using for the 12 and up. But that smaller dose has really prevented many of the side effects. We're seeing very few side effects among these kids getting the vaccine, the 5 to 11-year-olds, and it still has an excellent protective effect. So I think that is that reduction in dose is an excellent way to minimize those side effects while still providing good immune protection.
Oh, thank you. And what are your thoughts on mandating COVID-19 vaccination for children school age? I know to go to school, they have to have vaccinations against smallpox and other illnesses. Is that something that people should support or that you support?
I think that we have to think about it in an economic and public health context. As you mentioned, our schools already require many vaccinations that we have decided are safe and effective, and it is in our best interest to protect children who are unable to be vaccinated for whatever reason to create this herd immunity so that fewer children break through that vaccine-induced immunity. And I think that when, one thing that as a parent, again, I have experienced in the past couple of years is that truly weekly, I have a 2-year-old and a 4-year-old, weekly panic when your kid has a runny nose, you need to get him a COVID test. When is that going to come? When is the result going to be back? I can't cancel this meeting. And I think that requiring COVID vaccinations in our schools will help us get back to normal. It's a very safe vaccine. That's what I keep coming back to. It's a very safe vaccine, and we are at the point where COVID is a vaccine preventable illness. And so missed school days, missed work days, the rare complications are unacceptable when we have a safe vaccine to prevent this. So I expect that there will be a time when it is required for schools, but it's really too soon to tell.
In your experience, have you had any long haulers in children that you've been helping?
So the symptoms of long COVID are certainly more common among teens and adults. But I personally have seen teens with long COVID symptoms, and it can be extremely debilitating and depressing. It's one of those things like the symptoms make you a little depressed, but then the fact that you have fatigue and for example, a soccer player who used to be very active and on the varsity team and now just can't even get up to practice. And that was his thing. That was like what kept him going. That absolutely spirals in a depression sense. It makes him more depressed now. I saw another teen who had lost his sense of taste and smell, and it stayed, he did not regain that for many months. And that was extremely anxiety provoking and depressing for him. I mean, I think we sort of think, oh, that's not that big of a side effect because that's not life threatening, but losing the experience of taste and smell is a huge deal. And so, yes, I have definitely seen teens affected by long COVID, and it's not something to be taken lightly.
What are your thoughts on the uptick in the number of cases, the hospitalizations? I noticed yesterday there were over 290 hospitalizations. I mean, we're getting very close to where we were during the height of the pandemic. And I'm wondering, what are your thoughts on what New Hampshire is experiencing in all age groups right now?
So I think, people are relaxing a lot. And when the vaccine came out, we felt that we finally had a chance to relax in our, sort of really strict behaviors about not spending time with others and not, and masking and things like that. And truthfully, it's a challenging line between being completely paranoid, which is not good for you, and maintaining some caution. So I think we're all still trying to find that balance. I know that it is alarming. It is concerning. I think one step as someone, as a parent, again, I see so many other parents who are feeling so understandably anxious about this. What can we do? What can we do? You can get vaccinated. You can get your child vaccinated. That's one of the only things we can do in this time that feels so chaotic and scary. But we know that the vaccine is safe. We know that it offers protection. And so that's sort of one of the only ways we can move forward.
What's the future, doctor? What is our future?
I wish I knew. No, I think most infectious disease experts expect that COVID will become an endemic virus that every kid gets a couple times. And, they slowly build up immunity to it so that if by the time they're older, it's not so, it's not novel to their immune system and it's not so dangerous. Whether we will continue to need COVID shots on an annual basis, I don't think anyone is sure. I've heard some people say that if we give it to children when their immune system is so robust and active in their youth and they're able to form a really good immune response, we may not need to do it, every year. but it may end up being like the flu shot where you kind of get it every year. I don't think anyone is certain, but I do expect it to be a more common. The one thing that is very reassuring as a pediatrician and a mom of small kids is that little kids, like the little, babies, really do fine with COVID. Like, we worry more about other respiratory viruses with a 6-month-old than we do about COVID. They usually just have a cold. So that's, I expect that in the years to come, it will be just a virus that those little ones pick up at some point and get a runny nose, and their body gets a little bit of a immune response and memory to it.
How are the kids reacting when they're in your office? How are they reacting to getting the shot? Do they understand what's going on?
They are pumped, which is so much fun. I'm actually going this afternoon. So one thing about the vaccine rollout that I think it was a little bit spotty in the beginning, and we still don't have really any funding. So like, for example, our office, a small group, we're just staying late some days, coming in Sundays, and today's my day off, but I'm going in this afternoon. I know other clinics have had like volunteer Saturdays for their, different groups, but it's so much more fun than a day of swabbing noses, because the kids are like excited to be there. They, some of them are nervous, but they're like, oh yeah, my friend got it and he said it didn't even hurt at all. It's actually quite fun, and we feel really happy to be able to offer it to kids.
And how great is that from the point of view of a child who probably had a vaccine for something not too many years prior, right. So they have a recollection that they have a joy, maybe that's not the right word, but the whole thought, a positive thought of this, maybe that'll rub back on to some of our adults.
Yes. I think, it's really fun.
Dr. Arsnow, this is adding to your workload, which is probably already high, and you seem pumped as well. Thank you.
Oh, yeah. We go into pediatrics because we like helping kids, right? And so I will say it has been very tough to have to do swabs all day long, and the swabs hurt, as you guys know. So it's a welcome transition to be able to give vaccines, feel like I'm really making a positive difference. Everyone in our office is pumped about it too. So it's great.
Oh, Dr. Arsnow, thank you so much for taking the time this morning.
Oh, you're welcome.
We really appreciate it.
Well
nice
done.
to meet you guys. Take care. Bye.
Bye.
Thank you.